Welcome to Learn Medical Spanish. Today I'll be going over the phrases you might want to use to do a review of systems on a Spanish-speaking patient with chest pain. As has been the case with the past few videos and podcast episodes, this is geared towards emergency room providers, but anybody else who works in the medical field can probably learn some useful vocabulary or some useful phrases here. So as a quick reminder, if you're on YouTube, there's also a podcast version. If you're on the podcast, there's also a YouTube version. And you can find the links to either one of those in the episode description or the video description. And there's also a CME course that goes over very similar content for the common chief complaints in the emergency room. So if you're an ER provider, you can find the link to that course as well in the video description or the show notes. So let's go ahead and get started. I'm going to say the phrases in English. Then I'll pause long enough for you to think about the translation into Spanish, and then I'll pause after I say it in Spanish, and then I'll say it again in Spanish and pause again. So I'll say it twice in Spanish and give you time to repeat it out loud each time, because that's how you're going to learn it better, is if you're talking out loud, using as many of your senses as you can, listening and talking and even moving your body just for fun. So here's the first phrase. Do you feel short of breath? So think about that translation into Spanish. ¿Siente falta de aire? ¿Siente falta de aire? Do you also have? And so this is going to introduce a list of several things that come after it. Do you also have? ¿También tiene? ¿También tiene? Vomiting? Vómitos? Vómitos? Nausea? Náusea? Náusea? So both of those are good examples of words that are spelled very similarly in English and Spanish, but then you just got to use the sounds, the proper Spanish sounds, like the O is always O and the A is always A. So once you learn those vowel sounds, it's pretty easy to pronounce all these words. Sweats, sudores, sudores, fever or chills, fiebre o escalofríos, fiebre o escalofríos, cough, tos, tos, with blood, meaning the cough, does it have blood in it? Con sangre, con sangre. With mucus, as in, is it a productive cough? With mucus. Con flemas, con flemas. Heartburn, acidez, acidez, swelling in your legs, hinchazón en las piernas, hinchazón en las piernas, numb or weak arms or legs, los brazos o las piernas entumecidos o débiles, los brazos o las piernas entumecidos o débiles? That's a mouthful, so just in case it's not clear, brazos means arms, piernas means legs, entumecido means numb, and débil, or débiles for anything plural, means weak. Did you injure your chest? ¿Se golpeó el pecho? ¿Se golpeó el pecho? When? ¿Cuándo? ¿Cuándo? So, of course, you could use that word cuando for anything, in any context, once you ask about something and then you want to know when it happened. Do you feel pain in your stomach? ¿Siente dolor en el estómago? ¿Siente dolor en el estómago? Where, as in what part of the abdomen? Where? ¿Dónde? ¿Dónde? Are you pregnant? ¿Está embarazada? ¿Está embarazada? So that was the last phrase. So thanks for listening or watching, depending on where you are. So if you want to see similar phrases, you can check out others of my podcast episodes or some of the videos on my YouTube channel. So it helps to subscribe, obviously, so you can keep up with those. And I have a list of all these phrases on my website. I'll put a link to that in the video description and the podcast episode description as well. And as I mentioned at the beginning, and it should be clear based on what I was saying a moment ago, but if you're watching the video and you'd rather listen to the same thing as a podcast during your commute or something, I'll put a link to the podcast so you can easily find that, and vice versa if you're on the podcast and you want to find the YouTube video. This is also very similar to some of the videos inside the CME course that I helped create. It's called Essential Emergency Medicine Spanish. So you can get 23 CME credits for going through similar videos if you're interested in that. And you can find a link to that CME course as well in the description of the podcast or the video. So thanks for listening, and I'll see you on the next video or podcast of Learn Medical Spanish.